Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Welcome to Accelerated Health TV and Radio Show. I'm your host, Sara Banta. I'm a health coach, natural supplement expert, and a busy mom of three. Make sure you hit the subscribe button below so you're notified every week with my new podcasts on Mondays and Tuesdays. And if you haven't already, join my free group coaching on Telegram with the link below. There is no downside. I teach you on a daily basis with tips and tools to enhance your health, and you will be a part of a like-minded group to support you on your journey, in addition to truly taking control of your health. The protocols and supplements I discuss are all found at sarabantahealth.com. Today, we are talking about breast health and alternative care with Jannine Krause. She is a naturopathic doctor, acupuncturist, and host of the Health Fix podcast, which I have been on. She's on a mission to help women slow down aging by changing the way women access healthcare. And she's creating a community of women looking for inspiration, guidance, and ideas to maintain or optimize their health, fitness, and nutrition. I love following her on social media, and you should definitely be doing so. Welcome, Jannine. How are you today?
I'm great. Thanks for having me on, Sara.
I'm super excited to have you on. You're so easy to talk to, but you're so knowledgeable, and I love all of the content you provide. So thank you for that. And this is a topic that before I knew anything about doctors and, food and not microwaving my kids' food and my breast milk, and when I was making all those stupid decisions when I knew nothing about health, I was told and known that I needed to take care of my breasts and make sure that I'm getting mammograms and doing all the right stuff. So then fast forward to learning about some alternative ways of testing and things that you can do instead of the mammogram. So we're going to get all into that, and I'm super excited. So why don't you just give a little background to why you're interested in this topic and why you're so passionate?
Sure, absolutely. So, it's funny how we get into natural medicine and alternative medicine because usually there's a family experience. And in my case, my mom passed away from breast cancer in 2004. And I was a teenager when she was diagnosed and really didn't understand what all was happening. And as, things evolved and I saw how sick she was and I saw how she was going through all these different procedures, I was like, oh my gosh, there has to be more than this. There has to be something, better. And she found some naturopaths. She found an acupuncturist, and gosh, she got so much better in the time that she started seeing these folks. And unfortunately, she did pass away. There was 10 years though of some really decent quality of life. Yes, there was remissions and whatnot, but in that time, I learned quite a bit about breast health. I learned quite a bit about diagnosis of breast cancer. And one big, huge factor was that she had felt a lump a year before her doctor actually encouraged her to get more advanced testing and go beyond the mammogram. And that was something that set in my mind for years, going, why did you wait a year? And why was it only a mammogram? There was thermography at this time. Why didn't she do it? And so in my head, I had all these questions. And so I kind of made it a mission for myself to share with women the process of taking care of your breasts and what kind of alternatives there are, but also so this never happened to me too. So that's kind of how I got into it and how I started talking about it.
Well, let's talk about the importance of breast health and preventative care. One of the big things, and I'll touch on it later on, is I just did a podcast on PMS symptoms. And so we're talking about hormones, whether it's at the beginning of your life when you're a teenage daughter and you're experiencing PMS for the first time, or you're later in life and you're going through menopause and you're worried about breast cancer. I feel like women are just sitting ducks and they're not doing anything, and they're just waiting for that diagnosis. It's like, there is a way to prevent cancer, all types, including breast cancer. And what people don't know is, yes, I'm gaining weight. I need to take iodine for my metabolism and my thyroid. But what people don't know is there's actually 4 times the amount of iodine receptor sites in breast tissue. And there's something called competitive inhibition, where you overload your body with iodine, and that will kick out the toxins like fluoride, bromide, and chlorine that are finding those receptor sites, not just in your thyroid, but in your breast tissue. And that's leading to cancer and other diseases. So there's a way to prevent these diseases. And that's why it's so important that we talk about prevention. So let's talk about, what do you do for preventative care?
Sure. Everything you just mentioned, I actually will look at someone's whole environment. So air, water, food, what we put on our topically, like our skincare is a huge thing. This is one of my biggest pet peeves. And I know you talk about it as well, as all the parabens and the junk in our skincare. It's our largest organ. Whatever you put on this guy is really important. But, in addition to the lifestyle factors, we're also looking at stress. In addition to that, it is a big factor. But then I'm looking at, yes, we have mammograms. Yes, we're told to do self breast exams. But I'm not really sure many women are on point on their self breast exams as they could be. And this is something like, you have the ability to get to know your breast better than anybody else. Yes, your partner can help you out here. Always a huge fan of that. But you know your breast better than anyone else. When something isn't right, you are the one that's going to often find it before even a mammogram will. And I have a beef with mammograms because I have dense breasts. I have often had to go back because of abnormal exams. And of course they scare the daylights out of you, because if your mom died of breast cancer and you find out what age and you got to start going at that age, you're scared. But here's the thing, you can see things before a mammogram if you use thermography. And we have data now backing this up. I recently, and this is another beef I have, I'll give a couple of beefs and I won't go too long into this. We have data on thermography since 1956. And unfortunately, we've not been using it to its full advantage. Yes, technology, things of that nature. But even in November of 2022, we have a research study that says thermography as a breast cancer screening technique is a promising technology. And in January 2023, we have data that is showing a breast thermography evaluation using something called thermolytics. This is an AI, so artificial intelligence-based thermal imaging tool, outperformed mammography in women with dense breasts, and those reported with BI-RAD 0, which means is they technically have to go back in. And so this is a non-radiation tool that can detect things before a mammogram would, and it does it by thermal sensing, so heat sensing. So I look back at this and I go, gosh, if my mom combined with her self-exams would have had access to thermography, perhaps we could have done something for her instead of waiting for a year and then, oh, by the way, you're stage 4 and it's went to your lymph nodes. So preventative healthcare on this is looking at your entire environment of what you're exposed to, but also, could you have a baseline of something that is not exposing you to radiation and getting it earlier when you're younger? Because technically mammograms aren't technically offered till over 40. And if you don't have someone that has a history of breast cancer, that's when you can start getting them. So gosh, I could go on for hours, but I'm going to turn it over for you right now.
Well, I want to emphasize something about radiation. And anyone who listens to me knows that I talk a lot about the fact that we have non-ionizing and ionizing radiation in our lives at a huge level that our ancestors and even our parents and grandparents never had. 5G, Zooms, cell phones that are literally computers in our hands and are extensions of our bodies. I can feel the radiation when I hold my phone too much. And we know radiation causes cancer. It's causing all types of cancer, not just breast cancer. So here you are smashing your boob in a machine with radiation to prevent cancer. Is anyone catching on to this? And and the other thing is that with thermography, and correct me if I'm wrong, not only is it going to detect breast cancer, but it could predict and catch other types of cancers in the whole body, because it is essentially looking at the heat map in your body. Am I correct on that?
You're 100% correct. If someone does a full body thermography scan, which I recommend, it's only like $100 to $200 more depending on the provider. You're looking at $500 for valuable information on your health. And yes, it will show up with thermography. Things will show up as areas of inflammation long before they even turn into cancer, and even before you can see areas of issue on labs. Like I've seen issues in livers on thermography, and the person's labs are showing up completely normal.
Yeah.
And you can see gut stuff too. It's awesome.
Yeah, I mean, and our whole body works as a system. And unfortunately, the way the medical system is set up is the kidney doctor is focused on the kidneys, the heart doctor's focused on the heart. Well, when we look at what's causing all metabolic disease, mostly, I don't want to say all, mostly, we are looking as the root cause is insulin resistance and toxicity. So when you address those, all of the other factors are going to go away. And why am I bringing this up? Because if you're doing full thermography and you're showing inflammation in a different part of your body, it's going to become systemic, because everything is caused essentially from the same two problems, which are also interrelated. And that's why I always say, you gotta love your liver and clean it out. You gotta love your kidneys, because those are your filters, but they are being bombarded by toxins in our food, our environment, on our skin, everything that you've talked about. And it just, they're overwhelmed, and then things get backed up. The toxins then find those receptor sites, especially the ones that are meant for iodine, because go back to chemistry class, in the halogens, right? They all have the same outer shell for electrons. And so if there's not enough iodine in there, it's going to fill in with the toxins and the radiation that is going to then lead to the disease and lead to cancer. And this is just, the breasts are just one spot for that, but it's systemic. So, for all of you men out there listening, keep listening, because it's not just about boobs here. It's about overall health. So here we are, I've got two daughters, 16 and 18. Should they be starting to think about their breast health, or what age should women start thinking about doing thermography and preventative care?
Honestly, I think as soon as women start to develop breasts, they should be aware of them, because unfortunately, the way I grew up, I was a swimmer and I was also an ice skater, and as my breasts developed kind of rapidly for me at a young age, I was like 13 and had larger breasts. I was embarrassed of them. I didn't want to touch them. I didn't want anything to do with them, and I really think that was a huge mistake. Because the more you know about your breasts, the more that you can identify issues, especially like your connection to caffeine and drinking soda and what that does with your breasts as well. So in terms of your question is when should someone start with thermography? I honestly think at about 18, that's a good time, because you're an adult, but you're also starting to branch out of parents' home, right? And depending on how you grew up, you're on your own a little bit more. You're starting to see how, those snack treats, if you will, and different things affect your body. And so I think as soon as you can, I mean, honestly, 16, 18 years old, when someone gets their period, I think is a little soon, because you see a lot of flux. But by the time you're 16 to 18 years old, if you've had your period for at least a year, I think it's time to consider thermography. That way you can get a good baseline on your body. And some folks might argue with me on that. But the point being is, if we've had hormones coming out of the system and we've had a stable year of a period, now we've got a good baseline for what fluxes and what different things we can see within that thermography. And I think as soon as you possibly can. I wish I could have done it then.
And that brings up a point, because I'm sure there's not a lot of 16 and 18-year-olds listening to this conversation. But as a mom of 2 girls, I've always, from day one, from birth, and you might disagree with the way I parent, but I talk to my kids about their bodies. I actually did not hide myself in front of my kids, because I wanted them not to feel ashamed, not see mommy feel ashamed of their body, to be very comfortable with your body in general. And right now, the other thing we're dealing with in our environment is all of these estrogenic toxins that are mimicking estrogen in our body, increasing the xenoestrogens, causing this hormonal imbalance. And I've also talked about the fact that over the last 3 years, with what's happened, that's increased the spike protein in our bodies, which is also backing up the liver, causing a disruption in hormones, and has made the hormonal cascade worsen. So fertility is worse, infertility is on the rise, PMS symptoms are on the rise, menopausal symptoms are on the rise, unexplained weight gain. So you can only imagine what it's doing to breast cancer rates, just like all cancer rates. So here we are under more threat than we ever have been. So teach your kids to be comfortable with their bodies. Open that relationship, because I can tell you as a mom, since there was the open conversation about my body and seeing me naked and them naked and all of that, fast forward to when they're teenagers, they're still open to me. They're still talking to me about things that a lot of parents don't get out of their kids. And so it just increases that communication as a parent overall. But then you're setting your kids off with knowledge, with an ability to ask questions, not to be afraid to ask questions, whether it's to you or the doctor, and to be aware. And I think it's a shame that it's taboo to be talking about this, right?
Oh, it pains me. It pains me. And you know, I'm in my mid 40s. I know that in the 80s and 70s, when I was, you know, a real youngster, that it wasn't the thing, right? It still was hush hush. And honestly, like, I wish that I had that experience to feel more comfortable with my body. And you know, fast forward to this last year, I had a lump that I found in my breast, and the only way I would have found it is actually learning that I should do self breast exams. And you know, I don't know if I would have thought about that if I didn't go to naturopath school and didn't become comfortable with my body the way I am now. Yeah.
Right. Well, we know mammograms are the most common diagnostic tool. I live in Southern California, where breast implants are beyond popular. But there is this trend now that some people are taking them out. Where do the breast implants fit into the risk of breast cancer? And how does that affect mammograms when you're getting a mammogram with implants? And what are the side effects of having the implants? What should people be aware of?
Oh, wow. There's so much with implants now. And especially, like you had mentioned, there's a lot of folks who are doing explants now and taking them out. And one of the big risks with implants is that you're putting something into your body that is not part of you. So your body has to figure out what to do with it. And so I often will see autoimmune types of things start when we have implants placed. But the other big thing, and this is one that I do want to bring some emphasis to, is I'm seeing a lot of mold issues and mold encapsulation around the implants. And it doesn't matter what types, you know, silicone, saline, whatever. I've seen it with both. And I've seen people quite sick. And really, if they look at it and they look back in their history, when did I start feeling bad and just not myself and having hormonal issues? Because mold can mess with your estrogen levels. It's a huge thing, and it messes with receptors, just like you're talking about how the iodine can be incredibly helpful. The mold messes with your estrogen receptors. And so in this case, I'm really concerned about the folks who are putting in the implants and really the understanding of what they're getting into, because I think a lot of folks aren't talking about breast implant disease and I shouldn't call it disease, illness. This is a thing. This is a real thing. And so when we look at what happens with breast implants and mammograms, I mean, anyone who has small breasts or large breasts, a mammogram is really uncomfortable. And I would venture to say that anyone has something uncomfortable feeling with getting your boob smashed, right? It's between two plates. It doesn't feel good. And then if you're short, you've got to get on your tippy toes and turn. And I mean, it's a whole nother thing if you're under 5, whatever the normal is for someone. I'm 5'2". So it's a whole nother ball game. But when you have implants, now you're squishing a capsule. And, do I know the data on rupture with mammograms? No. It's been told that it's not a possibility. But what I've seen in my practice is that we can see a lot better what's going on with those breasts with thermography and ultrasound. One of the gals that was in my office, the gal that actually is in my office, not right now. She went to a different office because that's a whole nother story. But she was in my office before I moved my office. Let's put it that way. She did the thermography. We found that it looked like, gosh, it looks like the implants are leaking. So then we followed up with an ultrasound and really could get a good sense of like, holy cow, the breast implants are leaking. And she had no symptoms whatsoever of what you would expect. She didn't feel sick. She didn't feel anything different, maybe some fatigue, but she had no idea that they were leaking. And so what I would say is for women who are wondering, like, are my implants okay? I usually will start with thermography and recommend, if we find something on thermography, to look at ultrasound and get different views, because we can get a clue as to if there's any leaking going on or there's anything wrong. Can we tell if there is mold? Not necessarily, but we can tell if there's inflammation and we can see if the capsule is inflamed. And so that to me is worth diving in deeper. And so with mammograms and breast implants and things of that nature, I personally, I would look at thermography and ultrasound first. And if there's really something that needs to be gone into deeper, then consider, okay, fine, jump the hoop into the mammogram. And that's something I do want to say. For those of you who want to do the alternative way of screening your breasts, do know that if something is found on a thermography scan and it's found in ultrasound, you're still going to have to go back to a mammogram. That is the way the system works for you to even be cared for. And that is BS. It's BS. It's what happened to me. And it's what happens, unfortunately. But here's the thing. I want you all to know that for screening, thermography, you could do ultrasound to double check that. You can go, if there is something wrong, unfortunately, we will have to divert to going back to the mammogram. And it's unfortunate that these clinics will not accept a ultrasound that confirms finding something, because that is what happened to me. And I had to jump back through the hoops. So frustrating. So that was a long tangent for me on mammograms there. We'll let you.
No. So are you saying that health insurance doesn't cover the ultrasound and the thermography, or do they cover it, but they need then the mammogram to conclude?
Thermography is not covered by any insurance whatsoever. Ultrasounds are not, if they're done in the doctor's office as like a pop-up, as I would call it. There's a company called HerScan. They're wonderful. They used to come into my office when I had it in Washington. And those are considered non-diagnostic. So for insurance, you have to go back and get a mammogram first. Then you can go for an ultrasound. That's how insurance works. You have to jump through the hoops, unfortunately. And even if you ask to pay cash, it is still, you have to do a mammogram first, then an ultrasound. Our system is very broken in the breast health department. And it's one of my biggest frustrations, to the point where I've looked into how can I create my own breast imaging center so that people do not have to go back through this hoop.
Okay, so on top of all of that great news, let's look at the signs that people should be looking for in an unhealthy breast. What do we look for?
Sure. So typically we're looking for a change in the feel. And sometimes it can be the outer skin might have like a redness to it, a heat kind of to it if you touch it. It also might be sore, might hurt. That's a red flag. And another big red flag is something going on with the nipple. Discharge from the nipple peeling, the nipple looking really red and inflamed, having more heat in that case. Those are all like red flags that something's going on. Now, of course, I want folks to look at, is it cyclical? Is it a constant type of thing happening? Because if you get breast tenderness and it's cyclical the 2 weeks before your period, this is the great time to look into some iodine supplementation, but also it's a sign of excess estrogen and you're not clearing it. But it's also a sign that caffeine could be messing with you as well. Your breasts are very large glands, right? So they are receptive to cyclical changes in hormones. So it's something you want to think about. But if you have symptoms that are constant, so if you found a lump, because some people will have very lumpy breasts. I do. I have very fibrocystic breasts. And, it's hard to distinguish between something abnormal and not. But when you feel something over and over again, and it's there throughout your whole cycle and it's not cyclical, this is something you want to get looked at for sure. Now, toxins, dairy, gluten, those are also other things that could keep the breasts inflamed. And so a lot of times I'll tell folks, you know what, let's pull all these things out. Let's see what's going on. Of course, I'm going to do thermography in the interim to see what is up. And really, one of the other big things, and they call it Powday orange, which really looks like orange peel skin. And what it is like this retraction. So your skin kind of pulls and it looks dimply and it looks like the peel of an orange. This is something that we definitely, if something looks like that, we got to talk to somebody. And even if there's like stabbing pains in the breast that just keep getting you, it's worth talking to someone and getting an evaluation there. And also, like, if you notice that there is a change in the size of the breast too, that's, if one breast is larger than the other and you've known that since, you were born, because some people have different size breasts. That is a natural thing. That's you. But if all of a sudden it changes, now that's something we need to look into. Now, what I didn't mention is what kind of lumps are suspicious lumps. They're kind of hard. They're thickened. They often won't move. Lymph nodes, we can kind of move around a little bit. Something that's fixed, that's something, we definitely want to get that looked at. Also, if it looks like you have a bruise on your breast and you didn't bump into anything, there was no accident, that is something that, yep, definitely want to get that looked at. Now, I think for a lot of people, nipple discharge is going to get their attention, bloody nipple discharge, absolutely. And barring that you didn't just run a marathon and full disclosure, sometimes we get that rubbing stuff. If that did not happen, it's happening out of nowhere, that is something really, really huge. And like I had mentioned before, fixed pain, just random fixed pain. Could it very well be that you have a pec or chest muscle that you injured? Yes. Could it be a trigger point? Absolutely. In fact, here's funny news. Not so funny, but funny to me in a way. I work in the realm of pain and musculoskeletal stuff. And my issue actually ended up being a very enlarged part of my tissue that was torn in a pec when I was doing a lot of chest presses, trying to get a PR. Silly stuff, didn't put it together. But, of course, my mind went to the worst because of what happened with my mom. So side note, if you've been, a new workout, you've been pushing it in the gym, you have a fixed spot of pain in your breast and it's even a lump and you can feel it, it hurts, it's keeping you up at night, still go get it checked out and reevaluate what's going on. But my thermography did note that there was something there. And that's why we ended up going further through the ultrasound and jumping through some hoops there as well. So I never want people to discredit anything that feels abnormal in the breast. Go get it checked out.
Well, and that goes for anywhere in your body, right?
Mm-hmm.
Okay, so you've mentioned caffeine twice. And
Yes.
it's really intriguing me because I don't know anyone, well, I should say 9.9% or 9.9 people out of 10 are drinking their morning cup of coffee every day. Where does caffeine fit into this equation?
So caffeine and coffee's one thing. Also, the energy drinks, got to put it out there as well. Even large amounts of green tea or black tea. If you're hitting up quite a bit of that, you can have some stuff going there. Or pre-workout. Pre-workouts have some caffeine in there too. So where does it play out? It plays out in the impact of how it affects your glands. So your body, when you have more caffeine in your system, it gets your cortisol going. It gets you going. You're getting fight or flight. Things lock down. And the best explanation I have for the breasts in this case is that we actually lock down lymphatic flow. And so now we have fluid building up here. I also will see a lot of women with fluid in the armpits built up as well. And it's my theory that the fight or flight response locks down our lymphatics. And so we have the caffeine causing these things to the breasts get fuller, denser, but we also end up with armpit fullness too. So I really want folks to kind of think about that, maybe a different thought process than what the conventional description is of how caffeine affects the breasts.
That's really interesting because I'm just going through my own experience when I get in this cycle of being a little too tired and my caffeine increases, and oh gosh, that's weird, I'm retaining water and it's probably related to my lymphatics. So note to file. Thank you, Jannine. Okay, so if someone is suspecting some breast issues, what should they do?
Great question. So first and foremost, you want to get in touch with your doctor. And let's face it, having someone else do an exam for you on their breast that is familiar with what abnormal breast tissue looks like. So someone like an OB-GYN, so if you do have an OB still, or a gynecologist, those are the folks that you're wanting to go to first. Of course, we have nurse practitioners that are doing these sorts of things. So usually in lay terms, we call it the female doc. You go see your female doc and say, hey, something's not right here. Have them take a look. Now, in the conventional medicine world, the next step would be a mammogram. You have the choice. This is your body. You have the choice to choose. Well, maybe I want to get a thermography scan instead of a mammogram. And the way I would break this down for folks, if the lump is not over a large size, so saying it's like the size of a pencil eraser, it's smaller in nature, maybe you don't have any pain, you just have a lump there, maybe it's cyclical and you can't really nail it down. So there's a lot of maybes, and the medical practitioner you go to is like, I don't see anything major, but we definitely should check it out. You have the option for thermography. Now, if you have bloody discharge coming out of your nipple and you have a very large growth coming out of your breast, we're probably going to move you more towards, let's just get the mammogram and get you care as fast as possible. Because unfortunately, the way the medical system is, we're going to have to go that route anyway, especially if you want to use insurance. Now, here's an alternative thought process. What would you do for your treatment anyway? And this is something that I had to come up with in my head when I decided that, okay, I'm going to go through the mammogram and ultrasound. Would I go for chemo? Would I go for radiation? And I told myself, well, no, I wouldn't do it, actually. And now a lot of people are probably listening to this and going, oh my gosh, she's, a wild woman. No, I wouldn't do that. And I did do the mammogram and the ultrasound to basically appease the family. That's why I did it, because my family panicked. Now, when you think of like, am I going to do this? What is my outcome? What am I going to do? If you're going to manage it naturally, thermography and ultrasound can tell you what you're working with, and you can use it to monitor. You absolutely can. Now, this is on the fringe of anything you would hear from the American Cancer Society, from any of the Komen Foundation, any of those folks, because the traditional model is if you find something abnormal, you go straight into a mammogram. And as a medical practitioner, that is what I typically, as a standard of care, do recommend, with the caveat of, well, if something's abnormal, what would you do? And is it something that we could get away with doing a thermography exam instead? And so that's where there is some discussion around this. And of course, there's safety. We're going to be looking at, what what's the end goal here? But like I said, if you have bloody nipple discharge and you've got something, growing off of your breast, you may have the potential to do surgery, right? Maybe you'll choose not to do chemo or radiation, but maybe you'll have surgery. You will need to have a little bit higher interventions as the system will have you go through it. So it's a heavy conversation. Standard of care, something's abnormal, you go straight to mammogram, but do know that you have a choice in this matter.
So two things that I really want to emphasize here is you are in control. Your doctor is not in control of your health. They are getting paid to help you. That's like the waitress it's her job to serve your food. You have a choice to tell her what you want to eat, right? So you guys need to know to take control of your own health. Now, I'm going to talk about my own experience. I'm not giving you advice, but I can tell you that my 9-year-old son was diagnosed with leukemia. He's now a 20-year-old, very healthy boy with no cancer, no issues. And we did not go the traditional route. We healed him through supplements and diet. So there is a way to do it. And you also don't have to break down the whole immune system while you're doing it. So just want to put that out there to emphasize that you are in control and there are natural solutions out there. So wanted to talk about that, but and this leads into let's talk prevention. So what are things that women can do to prevent the breast problems so we don't even get to this point? Because you do not want to be sitting around like a sitting duck waiting for that call.
No. Proactive is huge. And really, like I mentioned before, it starts with your environment, the food you eat, the water you drink, the air you breathe, the people you associate with, your stress levels, but also working on your lymphatics, working on your breast, allowing circulation to happen really well. And Sara and I were talking about her castor oil with iodine. I mean, iodine, since I learned about it, has been the most magical thing for helping with my breast tenderness that I would have cyclically, my breast pain that I would have with caffeine or pre-workouts and things of that nature, and just periods being extremely heavy. Those are some of my experiences, and I have patients that I can give you hours of benefits that we found, but metabolism too. So your liver is your hormone that metabolizes your organ that metabolizes your hormones, and taking care of the liver, so huge. And castor oil and breast, like, let's talk about this. You have some amazing stuff that I would be using for some prevention.
So I'll just touch on those two things right now. So the accelerated scalar castor oil is enhanced with scalar frequencies, but when you mix them together, the acceleridine and the castor oil, you can do it on any part of your body. You can do a full body, but just by putting it on the breast locally, that will help with the tenderness, and it helps the absorption of the iodine to get right where it needs to go. And it's always better when you can take a supplement and get it to the source. I liken it to the fact that when you have a sinus infection and you take an antibiotic, you have to take the strongest antibiotics to get to this area because there's very little circulation up here. But when you use the accelerated silver and just shoot it up your nose, my gosh, it's gone right then. Or even the acceleridine with diluted in water. Don't ever do it straight because it will burn your nose hairs. But when you are able to get the castor oil and the iodine right on the breast, that is going to help the absorption. And the iodine is essentially, like I mentioned, when you because there's so much concern about overdosing on iodine. And yes, you can overdose on the wrong kind of iodine. You can overdose on the wrong kind of magnesium or any supplement or any food. But when the acceleridine is taken at higher levels, you are displacing all of the halogens, all of the toxins, all of the radiation, not just in your breast tissue, but everywhere. And it's known as antifungal, antibacterial, antipathogenic all over. And it also induces healthy apoptosis. What does that word mean? It means that it is the destruction of diseased and cancer cells. So the body is able to use the acceleridine to actually have that programmed cell death when you've got weak cells or cancer cells. Something that people don't understand is cancer is in all of our bodies, but they're the weak cells. They're not these big bad boys that are overtaking our healthy cells. It's when the immune system's suppressed that then the cancer cells can replicate and do what they want to do. But if your immune system's strong, then you are going to be able to take care of those diseased and cancer cells. But the iodine also helps regulate estrogen production, and then it supports cleaning the blood so the liver can do its job to detox the bad estrogens out of the body. And then it also helps reverse the damage done by the bad estrogens. And it's also anti-inflammatory. It's a powerful antioxidant. And it helps with that oxidative stress that, you know, we're talking about, caused by insulin resistance and toxicity as well. So just wanted to touch on that, but definitely you rub it on your nipples. You know, it's funny, Jannine, when I first started selling the acceleridine, everyone thought thyroid. But I started getting these testimonials from women going, my breast tenderness is gone. My breast pain's going away. My cycle, I don't have my PMS symptoms. My energy is better. The brain fog's going away, all these other things. But it's just so amazing how just that little change can make such a difference.
Absolutely. Absolutely. It's simple. It's one thing, you know, and people ask me sometimes, like, doc, what are like 3 things, you know, I can take? And iodine is definitely one of the ones, especially for women, hands down, that I do believe in hardcore.
And so what are a couple other things that you tell your patients to do as far as diet, maybe some other supplements?
Yeah. Actually, one of the things that I didn't talk about is testing and knowing how you break down your hormones. There's something called the Dutch test. ZRT Lab also has another type of hormone metabolism test. And really knowing where your body genetically is prone to hang up in your hormone detox processes is valuable information. Because if if your liver's struggling too, now I'm going to be like, you know what, let's give you diindolylmethane. So this is DIM. This is like concentrated broccoli stuff here. Broccoli sprouts are on my menu all the time. I make them at home, 1/4 cup a day. Fabulous research on that, folks. You can check it out for yourself. But a 1/4 cup of broccoli sprouts a day. Also, something called calcium D-glucarate can be incredibly helpful, especially if you have gut issues and you're prone to constipation, to help to clear the hormones out. So yes, those are some of the supplements. Knowing the testing. One other thing, if I can't like highlight it enough, is saliva hormone testing tells you what's going on in your tissues. Your blood testing of hormones can give you a baseline of what's happening in the moment. And if you wonder if you're building up estrone, inflammatory estrogen, saliva hormone testing is what's going to give you that answer. And that can be very, very crucial for a lot of women who have family history of breast cancer, like I do, and also just having tenderness, weight gain, especially really huge fluxes around your period. These are things you want to look into in terms of estrone levels. And also knowing, like, is my environment quite toxic to me? Do I need to make more interventions? So I use estrone, which is E1, it's our inflammatory estrogen. There's estradiol, our most useful estrogen. And then we have estriol, which is for vaginal health. But I love saliva testing. I even do it on teenagers to know what are we working with as a whole. So.
I love it. Well, before we go, tell people where they can find you. And please follow Jannine. She's amazing on social media as well.
Thanks, Sara. So you can find me at Dr. spelled out JKRAUSEN as in Nancy, D as in dog.com. That's my website. You can also find my podcast there as well, or you can go to anywhere you get podcasts. It's called The Health Fix. And you can find me on Instagram at Jannine, Jannine Krause, Krause. That's where I'm pretty active, and you get my thoughts and you get me there. No
I
filter.
love it. I love it. And I wanted to just touch on two other supplements in addition to the
Yes.
iodine is the accelerated ancient salt. And everyone's afraid of salt. Well, all salt isn't equal, just like iodine. But the accelerated ancient salt, full of 62 minerals, not just sodium, plumps up the volume of fluid inside and outside the cells, which helps clean the liver, supports that apoptosis, induces DNA repair, and cleanses the body of the excess bad estrogens associated with what's going on here. So we are kicking out these toxins, but we need to hydrate the cells with water and the accelerated salt to pump out those toxins. And it also helps break down fats in the liver and encourages better digestion. Another thing that we're going after here is inflammation in the body. We want to reduce inflammation in the breast and systemically. And I like putting people on the accelerated keto, flipping your body into ketosis, which is reducing inflammation systemically, helping sustain your ability to intermittent fast, which is the cheapest and easiest way to heal the body in general, helps with autophagy and that apoptosis that we've been talking about. But then it's also going to help cleanse the liver. So the accelerated keto has some ingredients in there that help turn the saturated fats into unsaturated fats in the liver, to cleanse the liver and to help burn that body fat. Because excess body fat, guess where all these xenoestrogens and excess estrogens are stored, right? The more body fat you have, the more estrogen you have. So to get rid of any excess body fat is part of the goal, and that will help your overall health, not just your breast health. This is so important, you guys. And then the accelerated thyroid, a lot of people say that their hormonal imbalances and symptoms are corrected when their thyroid's corrected, because the thyroid is the master endocrine gland. And the accelerated thyroid is a 3-part supplement that has been created with ancient herbals and advanced glandular therapy with some other ingredients, and also enhanced with scalar frequencies to not only support the thyroid and neutralize the toxins, the heavy metals and radiations that we've talked about, but to heal the thyroid. So you're going after it in all different ways. So you've got the accelerating helping your thyroid and the accelerated thyroid. And do the liver flushes, you guys. Not a big deal. Cleanse that liver, because your liver is your life at this point with all of the toxins that we are being bombarded with. So definitely a big deal to make sure you're cleansing your liver. Jannine, did I forget anything? One last thought.
Oh my gosh, no, I think you've covered it well. I think folks have a great idea of all the things that can help them to help the body detox and get the breasts on point.
Amazing. Well, thank you for joining us, Jannine, and thank you everyone else for joining us today. If you need my help, you can contact me directly through the website, sarabantahealth.com. Happy to put together a protocol for you. What did you learn today? Are you doing your own breast exams? What signs have you seen? Is your diet maybe something you need to look at? Did you realize that there's so much radiation and toxins in our food supply and our diet that we need to be aware of? Leave a comment below and let me know. Join the free group coaching on Telegram with the link below. There's no downside. I teach you on a daily basis with tips and tools to enhance your health, and you will be a part of a like-minded group to support you on your journey. The protocols and supplements we discussed are all found at sarabantahealth.com. You can follow me on Facebook and Instagram under Accelerated Health Products, and across over 100 channels under Accelerated Health TV and radio show. If you like what you heard today, share with a friend, share with the women in your life and even your daughters, and hit the subscribe button to share as well. Join us every Monday at 2 p.m. Pacific and Tuesdays at 1 p.m. Pacific. You can use coupon WELCOME10 for 10% off site-wide. Thanks again for joining us and have a great week.